Good morning and welcome to our second video. We have our patient here who's agreed to do this video. My name is Dr. Tom Norris with Norris Chiropractic, and we're going to talk about a neck adjustment. The last video I did, we kind of went over a whole spinal adjustment, explaining what the objectives and goals were with chiropractic and not necessarily explaining specifically how it works. This is a little bit more in depth of a video to objectively show an increase in range of motion, both with rotation and flexion. So we're going to start with just kind of getting a global, meaning a whole neck range of motion. So if I ask a patient to stretch, is what they're doing is they're stretching the whole region of the spine. My job as a chiropractor is to stretch individual segments, which will in turn lead to increased mobility of the whole region or global range of motion. So we're going to start with having the patient lean her head to the right as far as she can, and we're going to take this goniometer, a little measuring device, to measure angles. And it shows 20 degrees of measurement to the right, and then we're going to go to the left, and the range of motion is a little better there on the left at 30 degrees of lateral flexion. Okay, and now we're going to check her rotation. Again, have her turn to the right, and we're going to go to the old trusty goniometer. And normal cervical range of motion is 80 degrees, and we're at about 40 there. I want you to turn this way, and there's a whole lot better range of motion, as you can see, or maybe you can see with the video. She's got right at 75 degrees motion to the left. So obviously there's some resistance or an imbalance in the movement of her neck. My job as a chiropractor is to determine exactly which segment is lacking the range of motion and basically restore it with a specific adjustment. Not only restoring mobility, but also getting rid of some of her muscle tension. So what we will have her do is lay on your back so you're facing the ceiling. And we're going to go up each individual segment. The neck has 7 movable vertebrae, and we need to find out which one is limiting and inhibiting that range of motion. So right there, good. And again, the whole goal is to basically make her spine move better, in turn making it feel better and last longer. And there's the biggie there, so we're going to go to its end range and just restore mobility there. Pretty simple basic science. And in this way, again, we're going to do some stretching, and then we're going to recheck her range of motion, and it should be a whole lot closer to normal. All right, and I'm going to have you set up on the table. And we're going to put the old trusty reading glasses back on. And we are going to touch your right ear to your right shoulder as far as we can. Very good. We're at about 32 degrees there, so we got about 12 degrees of increased range of motion out of the adjustment there with right flexion. And we're right at 30 there. Very good. And for the biggie, let me have you turn your head to the right as far as we can. Yeah, I can already tell it's much, much better. And we're at 78 degrees. Perfect. Stay tuned for our third video. We'll be coming soon. Thank you so much and have a great day.